Welcome everybody, this is Gary Beck, your naturopath from the Maximum Wellbeing Thyroid Studio, and I have the pleasure of introducing to you to Dr Daryl Turner. Dr Turner, welcome to the Thyroid Studio.
Thank you, Gary. It's a pleasure to be here and to actually pass very important information onto your patients.
Thank you for being here. So I'm going to ask Dr Turner a question about iodine. Now, many of you will be aware that our thyroid gland needs iodine to perform, but I want to ask Dr. Turner, so can we talk a little bit about iodine and really what is it and why is it so absolutely important?
Okay. Iodine and iodide, which is a combination that you need, used to be found in our soils. It used to be uptaken by the fruit and veggies we used to eat. And of course, it is pretty prevalent, especially in shellfish, but in fish as well. Any ocean-going fish has iodine, and that's a natural source of iodine. Iodine is an element. You can find it on the element table, and it is essential for us to have iodine every single day of our lives. Iodine and iodide today is not prevalent in our food chain anymore. Hence, in the USA where I come from, we have a thing called the goiter belt. And people get giant goiters around their necks from lack of iodine. Iodine, because of intensive cropping, is no longer available in adequate doses within our food chain, and fish has become an expensive commodity. In fact, to get enough iodine and iodide, you have to eat 2.2 kilograms of fish a week. The only society on earth that eats that much fish are the Japanese. Now, the Japanese have very low incidences of prostate enlargement, prostate cancer, breast cancer, ovarian cysts, and uterine fibroids and thickening of the uterine lining because they eat fish soup for breakfast, they eat fish for lunch and fish for the evening meal. And that's the only society. They get an average of 13.8 milligrams per day. You need a minimum of 12.5 milligrams a day to be sufficient. The statistics on this, according to the World Health Organization, is that 98% of all Australians are iodine deficient. Now, why is iodine so important, right? As Gary just said, it makes the thyroid work. It converts a thing called T3 and T4 into a thing called free T3 and free T4. And that's the only form that the body can use. It happens in the mitochondria. So you've got to get the iodine into the mitochondria. Iodine is an amazing thing. When I was a child, if I cut myself, my mother would put this orange stuff on me that would sting. That is iodine, right? Because it kills all the pathogens. It kills anything that's bad, right? We ingest this iodine. There are lots of different iodines on the market, but you've got to have the right combination of iodine, iodide, and the right quantity. As I said, you need the 12.5 milligrams per day, and you also need the right uptake nutrients with the iodine, iodide when you take the iodine, iodide. The iodine, iodide is the main surveillance system against cancer. That's we're talking about it's absolutely essential to make the thyroid work. And if you're on thyroid medications, if you're not taking iodine, medications are not working at all. But iodine is the main surveillance system for cancer. It is what identifies what is cancerous and what is not. So if you don't want prostate enlargement or prostate cancer, if you don't want breast lumps, dense breasts, or hot spots, or leading up to that breast cancer, if you don't want uterine fibroids or thickening of the uterine lining, And if you don't want ovarian cysts, you should and must take iodine every single day. It's absolutely essential in prevention. But what else does iodine do? Iodine, if you're out hiking, right? This is just some of the minor information about why iodine is so powerful. What do? You put a little bit of iodine into your water and it purifies it from a stream, right? The iodine is absolutely essential for snake bites. If you get a snake bite, right, the best thing to give a patient straight away is iodine. It helps to kill the venom. And it just goes on and on and on about what iodine can and cannot be used for. If you have an upset stomach, you've got food poisoning, you simply take an iodine tablet. It kills the pathogens in your digestive system. But iodine is a little recognized but highly effective treatment that most doctors have forgotten about. It was used a lot more back in the early 1900s and the 1800s for those very items I just discussed, but it's dropped into unuse today because it's simple, it's not expensive, and it's very effective.
Yeah, that's interesting. There's some great tips there, folks. You know, the things that you can use iodine for, and we all, I'm sure, can recall that dark brown stuff that tends to stain things, whatever comes in contact with it. But yeah, remember, it kills pathogens, and it's in a sense a agent that helps the body keep clean and detoxify of a whole range of things. And the other thing, Dr. Turner, is that not only is it present in every cell in the body, but without adequate iodine, and this relates to what Dr. Turner has said about the higher incidence of prostate cancers, large prostate, breast cancer, etc., it actually is critical for the production of hormones right throughout the body.
Yes, that is correct. Iodine is an essential element that the entire body needs. Every cell in your body needs to have iodine in it. If you have too much of the things like broccoli or the cruciferous vegetables or fluoride or chloride, then or salt, these are the things that knock out the ability for iodine to get into your cells. For instance, if you're in an area where they fluoridate the water or chlorinate the water, iodine is not effective because they are halides, they're competing halides, they bind to the iodine atom and they won't let the iodine into your cell, as simple as that. So that is why fluoride and chloride and bromide. Now where is bromide? Well, bromide is found in your bread. All breads now have bromide in to keep the bread fresh. So you've got to basically, all baked products have bromide in. That beautiful new car smell is bromide. You're getting bromide in your car. That's paint smell, nice new paint smell, or the smell coming out of the lining on your chairs or your curtains that is bromide. And that is also knocks the iodine out. So the whole time in today's modern society, we've got them adding fluoride and chloride into the water. That's totally unhealthy, and of course they are poisons anyhow. You've got bromide, so we've been bromated everywhere we look. That nice new carpet you just put down is pushing bromide into your cells. And of course the chloride and iodide are competing halides.
Yeah, so just to summarise what Dr. Turner has said there, we've got a problem with the iodine not being in the soil at the same levels that it was in our past. So our food itself is lacking adequate iodine. And from the other side, we've got all these toxic elements, the halides, the chloride, the fluoride, the bromide, which actually compete within the body against the iodine itself. So we've got this double whammy in our modern society, which really does iterate the importance of supplementing with a high quality iodine product. And if you want some help to determine what that looks like and what would be best for you, then certainly we are more than happy to guide you in that direction to get you on the right source and the right product. So thank you, Dr. Turner, for coming in today. It's been great having you here, and I hope our listeners have got some excellent tips about iodine.
Thank you, Gary, for inviting me and letting me share my insights into iodine and the competing halides.
Excellent. Bye for now.